My name is Maggie Bailey. I'm an optometrist, and I specialize in binocular vision and eye movements, specifically double vision, blurry vision while reading. And we see this very commonly after concussions. Right beyond headaches and dizziness, the next most common symptom is eye issues, vision issues, blurry vision up close, and trouble with eye tracking and eye movements. With vision therapy, we can help rehabilitate this and get our vision back to functioning as we need after a concussion. We can do vision therapy for people of all ages without concussions who are having trouble tracking while reading, who are having double vision while reading, who are having blurry vision while reading. We typically don't see concussed patients coming into our vision therapy clinic for rehabilitation, for help with these issues. Not because it's not helpful, but because it's just not part of the protocol, or people don't know to go to an eye doctor or to ask to be connected with an eye doctor at their concussion follow-ups. Concussion commonly affects our ability to accommodate or focus up close. So whenever we look at something up close, our eye muscles have to flex and our eyes accommodate to make it clear instead of blurry. That's an ability that we naturally lose over time, and it doesn't affect us typically until about 40 years old. However, it's very common post-concussion for that to have an effect very, very quickly, even in very, very young patients. And so some activities we may do will stimulate accommodation and then relax accommodation starting at very low powers. These are with different powered lenses that we would put into a flipper, and we would flip back and forth as we're reading a book or a magazine or some text that's pretty easy to read. Eventually, we would move that difficulty level up more and more until the patient is a little more functional with their vision, and we see that translate pretty quickly to real life, whether it's reading for school or reading for pleasure or just gaining that ability back again. Another part of the visual system that is affected very commonly after concussion is our ability to converge our eyes, and that means bring our eyes in towards our nose in order to see up close comfortably. That natural movement of our eyes in towards our nose when we look up close is called convergence. And like accommodation, like our focusing ability, sometimes after concussion, that ability can be taken away almost instantly. We can help train that back with activities that have a patient look from far away to up close. Basically, if you watch my eyes, if I'm looking far away, they look more straight on, and if I look up close, they moved in towards my nose to converge. We would teach that dynamically, kind of building up, starting further out and bringing a target closer and closer in. We would also work on the flexibility, pointing the eyes far away and then up close and at some intermediate distances as well. When it comes to your vision after a concussion, please don't be discouraged if things are difficult at the beginning, or if you're slow to see progression, or even if you don't see any improvement at the beginning. Sometimes it takes work, sometimes it takes time. Please don't give up hope, and please don't be afraid to ask for help.